Vitamin D deficiencies are rampant and replete in our society today. If you haven't had your vitamin D levels tested through a good and proper blood test, I suggest you do that. And if you come back like most of the vitamin D tests that we see, we're going to see low. Now, the dosage is going to depend on what your healthcare provider determines is necessary for you. But when it comes to vitamin D, there's lots of different resources out there for it. Let's talk about what vitamin D can do first. Vitamin D has a direct impact on the immune system. Vitamin D is not actually a vitamin, it's a prohormone, and it's the one prohormone that can access every single cell of the human body. It has an impact on genetic changes. It has a protective effect from negative genetic changes. Vitamin D helps with the balance of calcium in the body. But I want to go a little further, and I want to talk about a product called vitamin K2 D3. Now, we have a capsule form for those people who prefer it. But my preferred use for vitamin D, or way to administer, is in an emulsion, a liquefied form for absorption and bioavailability, getting into the bloodstream. Liquid K2 D3. So we get the vitamin D, but why vitamin K? Well, vitamin D, it helps to balance calcium, but can also anchor calcium. It pulls calcium into the tissues of the body. Now, in a healthy body, pulling vitamin D into the bones is what should happen, but it can pull vitamin D into arteries, soft tissue. So this is where you see hardening of arteries, things like that. So adding vitamin K to vitamin D acts sort of as a governor, directing the vitamin D exactly where to put the calcium. And calcium in the bones, where it should be, acts as a huge metabolic reserve, meaning preservation of health, longevity, good things for you. So when you're considering vitamin D, definitely consider vitamin K with vitamin D. And if you're considering it, consider liquid K2 D3.